So remember, my orientation toward the autonomic system comes from a brain-centric perspective. A lot of what we look at with anything that's tachycardic, in my mind, we have to rule out these levels of autonomic hyperactivity. Autonomic hyperactivity is a condition that we usually associate with brain injuries, but looks wildly similar to what we look at in dysautonomias, where we have this coupling of things that shouldn't be coupled, where the heart rate goes up and the blood pressure goes up at the same time. And then we see along with that gets tied in sweating. You don't have to sweat every time your heart rate goes up. Sweating is specific to temperature regulation. But when you see all those things start to link together, you think about, well, where do they all exist together? Where do all these signals come from? They all trace back to the brain. The way that we first came to understand this was through the idea of autonomic hyperactivity, where if I injure my brain, I lose the inhibitory pathways that would normally govern these autonomic responses. And I know that that's complex, but blood pressure control should not necessarily be linked to temperature control, but here we are.